Charcot foot. Basically, this describes a condition where a joint in the foot basically disintegrates or melts. It gives the appearance, though, of becoming red and swollen and may mimic infection initially, but underneath the skin, the bone is literally dissolving. The causes of Charcot foot, overwhelmingly, the reason we see Charcot foot is due to diabetes. However, there are other nerve conditions which could cause Charcot foot. Diabetes is certainly the most common one. However, the reason why the diabetes causes it, nobody's quite sure. People have speculated that it might be due to your circulation or something within the nervous system itself, but nobody's really pinpointed it. In addition, sometimes we'll see that people who do a very good job of controlling their blood sugar still develop a Charcot foot or a collapsed joint. So although we always recommend that it's always best to control your blood sugar because so many of the problems can lead to it, sometimes we'll just see that it just happens. Symptoms are going to be redness, swelling, but not necessarily pain. So the symptoms of Charcot are going to mimic infection to some extent. With the Charcot foot, we typically only see this in diabetics who have developed peripheral neuropathy. So they're going to have some numbness and wouldn't necessarily have pain anyway. However, even for diabetics who have peripheral neuropathy, if there's infection, they usually will feel pain. And so this is something we can use to distinguish possibly the two conditions. In addition, if you have infection, you're going to have other signs such as fever, chills, maybe some nausea, vomiting, or just uncomfortableness. Whereas with the Charcot, it's really just a red, swollen foot, ankle, or leg. Treatment of Charcot is going to depend on which stage it is in. There's actually 3 stages. The initial stage we already discussed with the redness and the swelling. The second stage is the redness and swelling stops and the bone starts to fuse back together. And then the last stage, very much like the second one, the bones just get hard. The most critical stage of treatment is the first stage, because this is where the joint has dissolved and needs to be supported. And so typically what we will do is we'll put the patient in a conforming cast so that the foot and the joint can't shift or move, which could predispose that person to developing an ulcer or a sore because of a change in the foot type. And then during the second phase, where the bone starts to get hard, basically protected in a walking boot that people can remove, and then the third stage can be unprotected. But it's utterly critical that we support the foot during the first stage so that we prevent the collapsing that people might think of when they think of Charcot as far as a rocker bottom foot.